Air New Zealand's hit heavy turbulence with an escalating industrial stoush over claims hundreds of flight attendants are about to be laid off and ongoing questions about whether the company's doing enough to curb the risks of spreading COVID-19. The pandemic has forced the national carrier to slash international and domestic flights, with our borders basically shut and returning residents and citizens faced with managed isolation or quarantine on arrival. Not so for international air crews, who are largely exempt from the 14-day stand down, despite concern among Air New Zealand workers that it's putting them and others at risk. And there's evidence not all crew are following the strict rules designed to stop the spread of the virus. Here's the latest. Fasten your seatbelts, the ride is getting increasingly bumpy for Air New Zealand. Flight attendants claim 950 of them will be served redundancy notices next week. But they want the brakes put on the process, saying it started during lockdown, and even at level 3, company-led live streams isn't proper consultation. They've launched a letter-writing campaign to MPs asking them to get on board. Here's an extract.
We ask you to reach out to the Air New Zealand executive team and pledge your support behind our request that the redundancy consultation process is suspended until such time as we enter level 2 and a proper consultation process between the airline and its employees can be facilitated.
The letter also points out Air New Zealand is getting the wage subsidy, more than $70 million so far, and a $900 million government-backed loan. And for any fair and reasonable employer, that comes with obligations.
We believe commencing a fast-paced redundancy process is not in the spirit of the foundation of the wage subsidy, which was designed to save jobs, protect New Zealand's economy and ensure our nation is equipped with the resources needed to bounce back and recover after the COVID-19 pandemic is contained.
National's Todd McClay has got one of the letters.
I agree with them it's not fair, and for the sake of another week to show good faith in part of this discussion, I think Air New Zealand should look to do that. I've written to Air New Zealand to ask for a meeting, a briefing, and it just made the case to them that it's very important that all Air New Zealand employees are treated fairly and they see the process is fair and is robust. I will be talking to Air New Zealand directly and will raise this on behalf of the many, many thousands of Air New Zealand employees who have been writing to National Party MPs.
Yesterday, Air New Zealand staff got a company-wide email celebrating the fact Australians and Kiwis have chosen the airline as their most trusted, respected and admired brand. Ironic, says one crew member whose words are voiced by someone else to protect their identity.
Air New Zealand is focused on their shareholders and protecting their brand rather than their frontline employees. They should be looking inwards to pinpoint savings within their expensive senior leadership and executive team. These unsustainable salaries can hardly be justified when the average frontline worker who earns close to minimum wage is being made redundant.
Meanwhile, after previously refusing to release figures, Air New Zealand last week confirmed 30 of its workers have been infected with COVID-19. The admission came after Checkpoint revealed some Air New Zealand workers are increasingly uncomfortable with international crew being exempt from a 14-day stand-down following international flights, to allow for the virus incubation period. Let's quickly recap. These are the words of an Air New Zealand employee, revoiced to protect their identity.
On 19 March, NZ5 arrived at Auckland from LAX, on which 3 passengers tested positive for COVID-19. At least 2 crew later tested positive. A crew member from that flight, before testing positive, went down to Bluff to attend a wedding. And now we all know about the Bluff cluster.
Just 2 days after that story, Air New Zealand Medical Officer Dr Ben Johnson and its General Manager cabin crew Leanne Langridge addressed staff via a live stream. Checkpoint has obtained chunks of that streamed meeting. This is Dr Ben Johnson.
Important changes for you to know about, particularly if you're aircrew flying internationally. And there are changes around expectations on layover. In the past, there had been some discretion allowed around whether you needed to stay in your hotel room or not. And the wording of that requirement from the Ministry of Health was to stay in your hotel room if feasible. It's important that you know those words have been removed. And the clear expectation is now that you absolutely must stay in your hotel during a layover. There is no discretion There is no eligible reason that you can leave the hotel, and the Ministry of Health want absolute assurance from Air New Zealand that that's being complied with.
Let's pause for a bit because small details matter here. 2 weeks before this staff address, Ministry of Health advice to airline crews already clearly stated crews must remain in hotel rooms during layovers, including using room service. Yet Air New Zealand's Chief Medical Officer refers to outdated Ministry of Health advice from March 16th. That old advice is worded very differently. It says crews should remain in the hotel room if this is feasible. And the tougher rules have been in play for at least a fortnight before this staff briefing. Dr. Ben Johnson again from that streamed meeting.
Compliance with this requirement to stay in your hotel is really, really important. The New Zealand government is very sensitive to this issue at the moment. We've been very successful in New Zealand controlling COVID-19 internally. We'd like to keep it that way, and I know it's an inconvenience, I know it's hard, but this is part of the role that you play, keeping the rest of New Zealand safe.
Despite tougher border controls, Air New Zealand international crews have largely remained exempt from the 14-day isolation rule, with the exception of crews returning from Los Angeles. Crews say they are sometimes on layovers for 5 days due to reduced flight schedules, and Air New Zealand is still using hotels that don't have food on site. Again, this Air New Zealand crew member's words are voiced by someone else.
We are the essential workers as flight crew on the front line, away from our families for days at a time, bringing Kiwis back home. And Air NZ can't even put us in a hotel room with room service to comply with the Ministry of Health requirements. We are being set up to fail.
General Manager Cabin Crew Leanne Langridge addressed the issue at that same virtual meeting.
How are we meant to gather food in hotels like LA that have no room service then if we cannot leave? It's a good question. I can talk a bit about what a lot of crew have been saying to me is they've been getting Uber Eats and getting food delivered to the hotels. So that's what crew are telling me they're doing. I'm not sure about pilots, but I'm sure they're doing the same.
Yeah, there are an increasing number of services that will deliver food to you. Do understand that's a little more expensive.
Documents provided to Checkpoint show concerns have repeatedly been raised about crews not complying with the layover guidelines. And Air New Zealand last week conceded crew returning from Vancouver had to self-isolate after allegedly breaching guidelines. Since that incident, it's introduced a declaration form that crew must sign on departure and return, saying they have followed the rules. Now, the Transport Minister Phil Twyford and Air New Zealand Shareholding Minister Grant Robertson have declined to comment, and Air New Zealand declined our invitation for an interview on the program this evening. On changes to advice to air crews on layovers, the Ministry of Health says it is currently undertaking a more significant review of the advice to air crew, given the changes in the global situation, the changes in air movements to and from New Zealand, and as we are reducing community transmission, making the border the highest risk for new COVID-19 cases in New Zealand.